Hi everyone, and welcome back to Let's Chat with Kat. Today our topic is going to be hyperthyroidism, and I'm very excited to have two special guests come discuss this topic with us, Bailey Power and Cameron Glenn. Before we get started, and before I bring them out, I'd like to show you this quick little clip to introduce the topic. Are you suffering from an appetite change, can't sleep, or feel tired throughout the day? It might be time to talk to your doctor about these signs and symptoms. PTU isn't right for everyone, but it might be right for you. Okay, now without any further ado, I'd love to welcome Miss Bailey Power and Miss Cameron Glenn.
Thank you so much for
See you guys forever. How are you?
Isn't it so good to be done with nursing school?
Nursing school, man, those were the days. Anyways, so today's topic, as you both know, hyperthyroidism, a condition you two have been struggling with your whole life to manage.
We also see it all the time on the floor.
Yeah, so it's very frequent in your lives. So that's why I wanted to bring you guys on the show today to help us and all of our viewers have a better understanding on this illness.
Yeah, it can be hard to manage. Cameron, why don't you explain some of the basics before we get into the details?
Alright, so hyperthyroidism is a disease that causes an increase in the hormone thyroxine, and this leads to an increased metabolism, which can result in extreme weight loss and also can produce a really fast and irregular heartbeat.
Yeah, you definitely have to try, I know I did at least, have to try quite a few medications. Some common things that are prescribed to help with this disease are things like anti-thyroid agents and radioactive iodine.
And now you two are both on the same oral anti-thyroid med, is that correct? Is
Yes.
Propylthiouracil? Yep, that's
Yes.
correct.
Mm-hmm.
Okay, and this is like kind of like the last resort. This is if, medications haven't been working, this is the drug you turn to.
Yeah,
Yeah.
definitely.
So Kat, I think the reason why you didn't know the drug or you weren't super familiar with it, since we've been on a farm, is that it actually doesn't have a trade name. And if you remember, trade names are the more common names, like kind of the ones we would remember. We just call
Okay.
it PTU.
That makes
Easier to
sense.
use,
Yeah.
usually.
Yeah. Okay, so now I did some research, and I don't know how accurate it is. It was really hard to pronounce, so I did write it down. I'm so sorry. But let me know how you guys think this is with explaining how this drug works on the body.
Mechanism of action.
So, it works on the thyroid by inhibiting iodine and peroxidase from interacting with thyroglobulin to form T3 and T4, which are the hormones made by the thyroid gland, and this decreases the thyroid hormone production.
Yeah, it also interferes with the conversion of T4 to T3, so that really reduces the activity of these thyroid hormones.
So now, who can take this medication? Is it strictly for patients with hyperthyroidism, or can anyone take it?
Actually, it's been shown that patients with Graves' disease with
Hyperthyroidism.
also take this drug.
Okay.
It can also be given preoperatively when patients are having their thyroid removed and they don't really respond to methimazole.
Okay, awesome. So I think it's important to ask, is there anybody that should not be taking PTU?
Yeah, definitely. Obviously, if you've shown a hypersensitivity to it before, you wouldn't want to take it again.
Okay, that makes sense.
Also, this drug can be known to cause liver failure or liver issues, so it's important to just be careful if you're pregnant and checking what pregnancy category it is.
Okay, and I also heard that it can actually pass through breast milk if you are breastfeeding, so it's super important to make sure you talk to your doctor about how to feed your baby if you are breastfeeding and you're on PTU, correct?
Also, if you remember those pregnancy categories that we learned about all the different jobs.
Oh, yeah.
This is actually category D, so it's shown harm to human fetuses in human studies. So it's a little bit dangerous to use when you're pregnant, but sometimes it can really the benefits really outweigh the risks.
That makes sense.
Definitely talk to your doctor.
Yeah. Oh, it actually looks like we have a question from our audience member.
wow.
Why don't we show the camera to her? Hi, my name is Rose. Nice to meet you all. I was wondering if you could just explain the way that this drug is given and the dosages it comes in. Great question, Rose. So correct me if I'm wrong, this is an oral administered drug that is given initially, and it's in the form of tablets, and it is given, the initial dose is 300 milligrams, and it's given 3 times a day, so probably every 8 hours. And then the maintenance dose is 100 to 150 3 times a day in total. So the 3 doses will equal 100 to 150.
Right, so if my dose was if I was on 150 milligrams for the day, I would take 50 3 times a day.
Okay, that makes total
Exactly.
sense.
But actually, in patients with severe
Hyperthyroidism.
sometimes you can see dosages given in 400 milligrams, or if it's really, really bad, you can sometimes see it in the 600 to 900 milligrams.
Yeah.
Wow.
Yeah.
Huge dose. It's also important to consider that elderly and children may take this medication. Obviously in children it's not advised, like you really don't want to have to give it to them, but they can take it. If they're 6 or older, I think they're usually on about 50 milligrams a day in
Yes.
3 equal doses.
Now, for the elderly population, it's the same adult dose that they get, even though they, should be considered that they may have a decreased hepatic, renal, or cardiac function. They are still on the adult dose. They will not have a decreased dose regardless of their, health.
Right.
It's the same dose.
Yeah, that is totally true, and we know that as your age increases, your renal function may decrease, so you just have to be careful to watch how much of the drug is actually being absorbed.
And monitor obviously their renal function to watch for those effects.
Right.
Yeah.
So I think we've learned a lot since being here, and we're just going to take a quick commercial break. We're going to show you the side effects and the adverse effects of PTU, and we'll see you back in a little bit.
I've been taking this for about 6 months. I was told it takes a little bit of time to start working, but I think it's finally starting to help my hyperthyroidism. I've noticed some other interesting changes in the past 6 months. I'm sure it's just my period, nothing too serious, but definitely things in my body that I've never noticed before.
That's not your period. Did your healthcare provider not tell you the side or adverse effects?
Adverse and side effects? I was never told anything about that.
Skin rash or hives, nausea, vomiting, upper stomach pain or tenderness, joint pain, itching or tingling, loss of change in taste, loss of hair, muscle pain, headache, sleepiness, nerve pain, swelling, dizziness, enlarged salivary glands or enlarged lymph nodes, a fever, chills, sore throat, hyperthyroidism, increased especially with surgical procedures and partly if you are taking blood thinners, swelling, vascular inflammation, drowsiness, headache, dizziness, rashes, wounds, nausea, liver problems, joint or muscle pain, lupus-like symptoms, changing urination. Now we're going to transition into a nursing focused lens.
Yeah, so we're actually going to start with one of the nursing implications. Something that we're going to want to look out for is the white blood cell count. With patients that are on medications for hyperthyroidism, you want to look out for the white blood cell count because it can be decreased.
Okay.
Yeah, it's definitely important to monitor other lab values too. You want to take a look at your CBC with differential to see how your other blood cells are doing, how much you have of each one. You want to look at prothrombin time in case there's a risk for increased bleeding. You also want to look at liver function tests, which we remember are ALTs and ASTs.
Oh, yeah.
Also thyroid function tests, including looking at the T4 and T3 we mentioned earlier, thyroid stimulating hormone, TRAb, the antibody. In addition to LFTs, you want to monitor your patient for jaundice, as we know that's an indication of how their liver is doing. The U.S. has actually labeled this drug as hepatotoxic, so that's why it's another reason to be really careful with your elders and other people that might have impaired liver function.
Yeah.
Definitely.
So as we saw in the video, dizziness is a side effect, as we said. So I'm guessing that you would need to make sure that there are some fall precautions, anything to keep the patient safe, which is our overall goal, as we always know. And also an adverse effect, renal dysfunction. It's probably very important to keep an eye on the urine output. Another nursing implication for that would be to put eyes and nose, strict eyes and nose, and just monitor the fluid they're putting in and what they're excreting.
Again, if you're worried about their renal function, you'd also want to look at their creatinine levels.
Yeah.
So now we're going to be discussing patient teaching for PTU.
So like I was saying earlier, it's definitely important to instruct your patient, this is how many times a day you're supposed to take it, this is how much you're supposed to be taking. It's really important also to make sure you're taking it on time.
Yeah, and if you miss it, you have to take it immediately after you realize that you missed it.
Yeah.
And then how is it with the white blood cell count? Earlier you were talking about that. How should you educate your patient?
Yeah, so you just want to educate your patient and tell them to look out for any signs of infection. So something else that we didn't mention earlier but relates back to originally describing what hyperthyroidism is, you want to instruct them to take weights 2 to 3 times a week because hyperthyroidism can cause a significant decrease in weight, and if they had lost a lot of weight, they should be gaining it back.
And as for the dizziness and maybe the drowsiness, maybe it would be good to not drive or operate heavy machinery for a few days until you're familiar with the medication. And
I honestly tell all my patients to avoid that when starting a new med.
Yeah.
Just to make sure.
Something else too, interactions. This drug can interact with anticoagulants. That's why I was saying earlier you want to monitor your patient's prothrombin time. Also, it can interact with beta blockers too.
Yeah.
So always take those vital signs.
Yeah. I'm so glad you guys could come in. This was amazing. I hope our viewers learned a little bit more on hyperthyroidism and PTU, and check in with us next week.